Hi everyone, welcome to Nature's Way of Healing. My name is Dr. Carine Hall Brown.
And my name is Brother Willis Harris.
Today I have our special friend Brother Willis, who I have worked with before on this media. Now today Brother Willis is going to work with me to present the natural remedies that we will use for pneumonia.
The purpose of this video is to promote the understanding and knowledge of various health topics. It's not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment before undertaking a new healthcare regimen. And never disregard professional medical advice or delay in seeking it because of anything you have watched here.
Now, the goal and objective of this program is to present all that is natural, using also inclusive of the laws of health, because a part of this program is to present the laws of health in our how to apply the laws of health in the healing process of any sickness or ailment. So we are going to go right into our presentation. Now, some of the natural things that we could use for pneumonia, and as we go through the laws of health, we're going to talk about the natural remedies that we could use to alleviate pneumonia once we get it. Now, Brother Willis, what are some things that we could use to alleviate pneumonia?
Okay.
And when we talk about, let's look at nutrition, because that's like first and foremost.
Okay. Nutrition, when we deal with pneumonia, we're understanding that it's we have to treat the body. So it's one of the things we must consider is vitamin C. When we use vitamin C, particularly fresh lemon juice should be taken for two reasons. It is very high in vitamin C, and it also will give you a lot of energy. Nutritionally, when we're talking about it, liquids, moderate liquids. If we are going to boost up liquids, we should be taking in more like teas and soups, broths, because in the process, as you mentioned earlier, that the person suffers with periods of lethargy, periods where they lose energy. And when we eat heavy foods, we tend to cause the body to labor more to digest. So with nutrition, this is what I'm talking about. Also, zinc. Zinc is extremely effective in dealing with the flu because the proportion of zinc that is needed to clear out the whole system, and it works as a strengthener also. So it boosts up the system.
And Brother Willis, does zinc has anything to do with liver function?
Yes, it does. Because of the amount of infection that we have in the liver, most of it is still trying to leak into, in the lungs. Most of it is trying to leak its way into the liver. And we know infection means poison. So what the zinc does, it also detoxifies the liver.
Okay, so nutritionally for us, we need high vitamin C. We also need vitamin D, which is critical at this time of the year. Vitamin D boosts every single organ, and it also is very important for the normal functioning of the liver, as you were saying. Vitamin A, which is also critical because that helps in the repair of the tissues lining the body, so that is very, very important. We also need our calcium and our magnesium. Magnesium is very, very important for relaxing the muscles, because at this point when we have pneumonia, I'm thinking that our bodies is contracting a lot, and that contraction, the magnesium will help in relaxing the muscles. So that is also, so we could take magnesium as a supplement. We could also take a hot bath with magnesium or in it. I mean, Epsom salt is high in magnesium, so that's something that will help to relax the whole body. And if we're soaking in it, just know that some of it is going into your body. Okay? And while we're at it, if you're taking a bath with magnesium, you could add some essential oils to it, which is going to clear the air in, clear the respiratory tract. And all kind of steam is extremely important during this process. Okay, so we have that in essence is hydrotherapy, and consuming a lot of fluid. Brother Willis says we need to consume quite a bit of fluids, and that's also taking in fluids in another way. So making as much liquid in your environment as possible. And one thing that we must must always remember that is very, very important is that you should not drink too much liquid at any one time, because this will cause the lung to expand, the stomach to expand. And once the stomach expands, it's going to put some pressure on the lung. And you don't want that pressure on your lung when your alveoli is full with pus, and it is going to cause you to feel uncomfortable. So you take small doses of whatever liquid that you can take in at any one time. What other form of hydrotherapy? What else could we use in this in terms of alleviating?
Okay. So what I think of in the other forms of hydrotherapy are two things. You mentioned the elderly. You've mentioned the very young. And they experience worse, again, because of their ability to fight off anything. So their immune systems are not very strong. And in the case of these two age groups, age categories, most of the time you find them would be more bedridden because lack of energy. So I would consider, as much as I love the sauna, the steam sauna, you wouldn't be able to get them up. So I would do the foot bath. A nice foot bath, you can lay them to the side, particularly an elderly person, edge of the bed, fill a basin with warm water, and you just put their feet in with whatever you need to treat with. You could use the Epsom salts, as you just said, and just let them lie and cover them over, and that will cause them to sweat. For babies, you can do the same thing, but for babies and a little bit of hydrotherapy is, and it's not really hydrotherapy, it's steam therapy. You can take, the mother can take the child into the bathroom and turn on the shower and let the whole shower, the whole bathroom steam up. So you're creating your own sauna. And that way, yes, it's a little bit uncomfortable, but what you're trying to do is to get the pores to open up and that the baby gets a sweat.
And that's good for like when the baby has a fever.
Fever, okay. Any type of respiratory ailment, including pneumonia.
Okay, and the foot bath, the hot foot bath would be good because what it does is pull.
It pulls all of the toxins from the head all the way down and exits through the feet.
And also,
through the pores of the soles of the feet.
And I was thinking that it might also pull the concentration of circulation from the area where it's congested to the feet, so it kind of alleviates that congestion in that area. Okay, now we talk about drinking a lot of fluid. So one of the fluid that I concocted up that we could use for today is fenugreek. Fenugreek is a herb. And what we could do is put our fenugreek or ginger, which is also a calmative, and turmeric. And just like we had spoken about for bronchitis, For pneumonia, we don't want to stop. We don't want to actually stop the coughing because coughing is very, very important. We want to just reduce the inflammation that is being experienced. So we're going to put 1 teaspoon of turmeric, 1 teaspoon of ginger, and a teaspoon of fenugreek seeds. And the fenugreek seeds, the turmeric, and the ginger together will help fenugreek is extremely good in removing phlegms from from the respiratory system. It removes mucus. It works miraculously to remove mucus. The turmeric is an excellent anti-inflammatory herb, and also another herb that I would add, because golden seal root is an antibiotic, antiviral. So regardless of what you contract your pneumonia from, you can use golden seal root as a part of your treatment. So this is one thing with your fenugreek, your ginger, and your turmeric all together. And this is a super anti-inflammatory mucus removal and antibacterial tea that you could sip on all day, which will help in alleviating all the symptoms that you're experiencing from this pneumonia. This is excellent, and if you want, you could add a little Manuka honey to it just to make it a little bit easier for some people who might have trouble just bringing this down without sweetener. But you could add a little Manuka honey to it to give you a little ease, but it should be fine just drinking it like that. And this is a super anti-inflammatory, antibacterial, and a tea which is going to help to remove the symptoms that we are experiencing from both the inflammation in the lung and also the fever and the chills and all the other symptoms that comes with pneumonia. And as I said, we don't want to stop the coughing. The coughing is critical. When it gets to the point where it's stopping you from sleeping, you could take something to alleviate it a little bit, but you don't want to stop it.
So some of the things that also can help with the alleviating of the coughing, because really you want to get all of this stuff out of the alveoli, out of the whole respiratory system. So we can use something like, there's a lung tonic with, and these are some of the herbs that you can use. Sister Carine mentioned earlier. I usually do a lung tonic, which from some herbs, some in my cupboard. So I have some horseradish. I have some ginger. I spoke about lemon juice. I spoke about garlic, Manuka honey, and a little bit of cayenne pepper because it will drive everything into the system. Actually, it's a stimulant, so it will stimulate the alveoli also to become active and pull everything out of the system. We also have some. We also have cough medicine, and some of the herbs that we use for cough medicines are like peppermint, licorice. Again, I love to use ginger, horseradish. I love horseradish. Two of these herbs that I really like because, and it's not only for this time of the year, but it tends to work throughout the system of the lungs and also the urinary system. Because as much as we may not realize, as we don't feel the effects of infection in our lungs and our urinary system until they really become inflamed. So like something like horseradish, like I do. And for those who love to eat sushi, this is the main ingredient in the wasabi paste. That when you have it, that green stuff, you realize when you have it, you feel it coming down. And so this guy is responsible for a lot of things. What it does, I have it, I pickle it, and I eat them. I put a little bit of apple cider vinegar, a little bit of sugar in them, and I have it in a jar and I eat it because it works as a vacuum. When we talk about the dust buster, it goes into the respiratory system, the alveoli particularly, and it sweeps it out and pulls out because it decongests everything. Also for UTIs, I'm mentioning it because they kind of interconnect. When you start expelling, some of it goes down into the urinary system also. So if you keep that area clean, it works. It's going to help you, this guy.
So the horseradish help holistically
Yes.
to actually clean
Yes.
all the toxin that comes out when we're flushing our system, and it cleans the urinary tract. So therefore, after you have pneumonia, you won't be infected with a UTI after. So it's a good addition that we want to make to our diet, as a matter of fact.
So we're talking about garlic. This is an antibacterial. And you want to know how good garlic is? Try crushing a clove of garlic and either keep it on the palm of your hand or put it put your feet on it and just stand there and talk. And in like 2 minutes, you will begin to taste the garlic in your mouth. This is how easily absorbed, and it's an antibiotic. Most people, when we have strep throat, and you take, they give you antibiotics for it. Easy thing for strep throat. Grate some garlic, grate some horseradish, put it in some honey, just pour honey over it, and just drink it. In 2-3 days, and you keep doing it, as much as you want. In 2 days, it's cleared up.
Okay, and our next thing that we're going to talk about is how to do an onion poultice.
So an onion poultice, again, this can be done for everyone. But again, my focus always with pneumonia are the two spectrum of the age groups that I talk about all the time, that I've been speaking out right now. And people who are immobile, because one of the things that you touched on is exercise and movement. Most of the time when we're sick, we don't really want to move. And think about it, when you can't breathe, then you have no energy. And you mentioned it earlier that oxygen is not just breathing in. The mechanism of it is really to produce energy. So if this guy, a couple of these, let's say half of this, of the alveoli, let's just say half. In fact, you know what? I'm sorry. Let's say a couple pieces, right? A couple just got infected. How much oxygen are you getting? A full 100%. So then your energy level is totally compromised. And you begin, you can't eat, you can't sleep because you're coughing, your oxygen, carbon dioxide exchange is compromised. So you don't want to do anything. Exercise is the last thing you really want to think of. So what I do is an onion poultice that you can apply, which also will help greatly in fighting fighting off the pneumonia. So you're taking some of these teas, you're taking everything else. But the purpose of doing all of this, because I know the question is going to be asked, all of these things and whatever, which one do I use? You know what? I say use as many things as you can that you know. Why? When we deal with therapy and sickness, particularly viral sickness, the idea is to use it, the analogy of watching a boxer. When you look at a boxing match, you don't see one boxer just going here, right? Because then the guy would know that you're just going there. But what they do, they work all different parts of the body. They work it over to make sure that this person now doesn't have it in him, so that he could stand. The same approach should be taken with our sicknesses. So you can't breathe, you have pneumonia and whatever. No, work on the whole system. Give it everything that it needs. Because you know what? Everything is nature's, and our, right now the segment is nature's way of healing. There is no wrong way that you can't use. These are herbs that God created for us. For us. And you have to look at it that way. This is mine. And it's not poisonous. The body will use it. And the body has been so wonderfully made in that it will take what it needs, and what it does not need, it gets rid of. So the onion poultice, I believe, particularly at night, when the patient is restless, you can use the onion poultice. So, if you don't mind, so we have an onion, depending on how much you want to make and how big the person is. So let's slice this onion a little more. You take 2 or 3 cloves of garlic. You add some warm water. Now, normally you can cook.
How much warm water would you add to a half of onions?
Half of onion, depending on the size of onion, I would use like half cup, because you really want it to be a paste. Okay. And it releases also its own water, liquid. Okay, there we go. So most of the time they'll ask you to grate it. So if the person who is preparing it, if you grate it, you'll realize that you're crying. That's a good thing. I'm hearing that they want to have tearless onions now. And that is a big concern for me, because I want my onions so that I could cry. It gets the sinuses involved and the tear ducts, so that anything that's caught in between there will come out. Okay, so we blitz it. So you have your paste here. You have it here. It's warm. The reason you use, normally, as I said, you would grate it and you'd put it on a hot plate or something like that. But I find it more effective if you blitz it with warm water, lukewarm water, because when you're cooking it, you're cooking out some of the components, the active components, like the allium and the allicin, which is most important for the poultice. Actually, they are both antibiotic and antifungal, and they decongest the system. So you take it, place it down. I'm sorry. You take it, some flour, and you're adding the flour to thicken it into a paste. Now, one misstep that I made was that I could have put this back into the blender and let it mix thick. So look at the consistency right now. You could add a little more because you really want it to be thick and pasty. May I have a little more flour? Now another thing that, where is it? Another thing that you can add if you have it, nutmeg. Nutmeg is not just a spice that we put that tastes really good in sweet pastries and drinks. Nutmeg has been also proven to work very well in the respiratory system. So so now really thick, right? So this is how it should look. Really pasty. And if you want to test it, just put a little bit on. Doesn't run.
Okay, so who do we apply this to and how do we apply it?
Okay, the application is simple in that you have the person laying on the bed and you take the paste.
How do they lay down?
Okay, well,
Back, on the front, how do they?
you lay them on the front first
Okay.
and you put the paste on them, on the chest, smear it over the chest. Why the chest first? Because you know the lungs is closer to the back, right? Mm-hmm. Why I would do the first? Because inhalation. So now you're getting to inhale all of the properties, the allicin and the allium that goes down into the sinus. So it starts working from here down. So you paste it on.
So when you put this on, do you cover it with something?
Okay, so what you do is that you cover the whole chest area first with it. Then you put a rag on and you secure it.
Or do we wet the rag? Do we just
You
put a dry
can
rag?
wet it, you can dry it. You can wet it or you can put a dry one.
Is it hot or cold?
Warm is better because, again, we're talking about comfort and because the body, you need to get the body involved. So cold causes everything to constrict. Mm-hmm. So that's hence the reason we wanted the lukewarm water also, so that it's easier for the pores to just open up and start taking it in.
So just a rag. You wouldn't suggest using anything like a saran wrap or anything like that so that it doesn't get all over the place?
But what we're doing is that we first making the application to the chest because remember I'm saying we're going to the back also.
Okay.
So I'm saying the chest first. So you can ask the person to just hold the rag. So let's say that it's on me. You say just hold it and you turn them to the side and now you apply it to the back. You do the same thing with a rag to the back. Now what you can do is, because it's pasty, the rag is going to stick. So you just smooth it out. So you just smooth it out and let the patient, if they can, if they don't have the energy to stay on their side, just ask them to lay back. Now you're going to get your saran wrap and you put it on over the area and you wrap it all the way around and secure. Now, in order to even make it more effective and stay in place, get like a tight or old t-shirt that you really don't want, but get one tight. So if person is very, then get a tight one so that it would stay in place whilst the therapy is continuing on.
What if it's a baby?
If it's a baby, then hence the reason what you're going to do is just put more just to make sure that it stays.
Okay. Okay, any questions about this onion poultice, you could always put them in the comments section just below this video clip. Okay. And the next thing that we will be talking about, go ahead.
Okay. These are some lozenges that also we talked about just hitting from every angle. You can make sure that nothing is missed. So again, we talk about horseradish, and some people, again, because of their experience, even with going to have sushi or having the wasabi, they don't like the spiciness of it. But again, because of the function of the horseradish, I like to put them in my products, in the products that I make. So this has
So we have horseradish in our lung tonic, in our cough drops, in our lozenges. So we have horseradish in everything.
because again, we are looking to get the best way to get rid of infection. So this is a cough drop, let's put it that way. A lozenge. It's honey, ginger, lemon, and horseradish. It's a hard candy, so you should be sucking on it. What I did also, I grate a little bit on it to make sure that you have the flavor.
So while we're doing the onion poultice, or we're drinking our teas in between, we can have those so that we're hitting this pneumonia from any angle or every possible angle. Now, now for all the recipes for these, we will definitely put in them in the description section below this video clip. So if you have any questions, you could also put them there as in the comment, and give us a thumbs up if you like this video clip, and tell us how it works for you if you actually like it. I'm going to try one of these. I'll tell you how it tastes. It's very good. I could taste the horseradish, and it helps in clearing the respiratory tract. I could feel it right now.
My question to you is, do you think that any one of these ingredients in this is overpowering?
Absolutely not. It's not overpowering. I can taste the ginger. I could taste the horseradish. They're separate in my thoughts and in my taste buds, so I'm tasting them. And I feel them actually going into my respiratory and clearing my sinuses as I just continue to taste it and feel the effect of it. Okay.
So I would really like, if you would like, we're putting the recipe, I'd really like you all to try this also. Because again, with all the products outside, we really don't have anything that we can say that really works, that's natural. So if you're making your own, you know exactly what you put in it also.
Good. I hope that you guys enjoyed watching Nature's Way of Healing. We are thankful that you have taken this time out to watch this program, and you could give us a thumbs up if you feel like this have been helpful to you. Like us on YouTube. Thank you.
Thank you.